Question 1. What rhythm is characterized by an irregular ventricular rate with no distinct P waves visible? A. Sinus tachycardia. B. Atrial fibrillation. C. Ventricular tachycardia. D. Atrial flutter. Answer: B. Atrial fibrillation. Rationale: atrial fibrillation shows an irregular rhythm without identifiable P waves due to chaotic atrial activity. Sinus tachycardia has regular rhythm. Ventricular tachycardia usually has wide QRS complexes and regular rhythm. Atrial flutter shows sawtooth flutter waves, not absent P waves. Question 2. Which rhythm presents with progressive PR interval prolongation followed by a dropped QRS complex? A. Mobitz type 1 Wenckebach. B. Mobitz type 2. C. Third degree AV block. D. First degree AV block. Answer: A. Mobitz type 1 Wenckebach. Rationale: Mobitz I is characterized by progressive lengthening of the PR interval until a beat is dropped. Mobitz 2 has fixed PR intervals with drop beats. Third degree block shows no relation between P waves and QRS. First degree block has prolonged PR but no drop beats. Question 3. What is the appropriate nursing action for a patient in ventricular fibrillation? A. Administer formoterone. B. Perform immediate defibrillation and start CPR. C. Apply oxygen and observe. D. Administer atropine. Answer: B. Perform immediate defibrillation and start CPR. Rationale: ventricular fibrillation is a pulseless emergency requiring immediate defibrillation and CPR. Amiodarone may be given after defibrillation, but is not the first step. Atropine is ineffective in this rhythm. Simply applying oxygen and observing is unsafe. Question 4. A rhythm strip shows regular rhythm, absent P waves, and a heart rate of 50 BPM. Which rhythm does this most likely represent? A. Sinus bradycardia. B. Junctional rhythm. C. Atrial flutter. D. Sinus arrhythmia. Answer: B. Junctional rhythm. Rationale: junctional rhythm often has absent or inverted P waves with a rate of 40 to 60 BPM and regular rhythm. Sinus bradycardia has normal P waves preceding QRS. Atrial flutter shows sawtooth P waves. Sinus arrhythmia has irregular rhythm. Question 5. Which ECG characteristic differentiates ventricular tachycardia from supraventricular tachycardia with aberrancy? A. Narrow QRS complex. B. Wide QRS complex. C. Presence of fusion beats. D. Regular P waves before QRS. Answer: C. Presence of fusion beats. Rationale: fusion beats occur when ventricular and supraventricular impulses coincide and are a hallmark of ventricular tachycardia. Both VT and SVT with aberrancy can have wide QRS complexes, but fusion beats help differentiate VT. Narrow QRS is more typical of SVT. Regular P waves suggest SVT. Question 6. What is the priority nursing intervention for a patient exhibiting third-degree AV block? A. Administer atropine. B. Prepare for temporary pacing. C. Administer beta blockers. D. Encourage deep breathing exercises. Answer: B. Prepare for temporary pacing. Rationale: third-degree AV block causes complete atrioventricular dissociation, leading to severe bradycardia requiring pacing. Atropine is often ineffective. Beta blockers worsen block. Deep breathing doesn't treat it. Question 7. A patient's ECG shows sawtooth waves at a rate of 300 per minute with ventricular rate of 150 BPM. What rhythm is this? A. Atrial fibrillation. B. Atrial flutter. C. SVT. D. Junctional tachycardia. Answer: B. Atrial flutter. Rationale: atrial flutter has characteristic sawtooth flutter waves at atrial rate 300 BPM with variable ventricular response, often half the atrial rate. Atrial fibrillation has no organized atrial activity. SVT and junctional tachycardia lack sawtooth waves. Question 8. Which medication is contraindicated in patients with Wolff-Parkinson-White syndrome experiencing atrial fibrillation? A. Adenosine. B. Digoxin. C. Amiodarone. D. Procainamide. Answer: B. Digoxin. Rationale: digoxin can increase conduction through the accessory pathway in WPW, worsening arrhythmias. Adenosine and procainamide are preferred. Amiodarone may be used cautiously. Question 9. What clinical sign most indicates that a sinus bradycardia patient needs immediate intervention? A. Heart rate 55 BPM while sleeping. B. Dizziness and hypotension. C. Mild fatigue during exercise. D. Normal blood pressure with HR 50 BPM. Answer: B. Dizziness and hypotension. Rationale: symptoms of poor perfusion, such as dizziness and hypotension, indicate hemodynamic instability needing intervention. Asymptomatic bradycardia often requires no immediate action. Question 10. Which rhythm is characterized by irregularly irregular rhythm with no discernible P waves? A. Atrial fibrillation. B. Atrial flutter. C. Sinus tachycardia. D. Ventricular tachycardia. Answer: A. Atrial fibrillation. Rationale: atrial fibrillation has a regularly irregular rhythm and no visible P waves. Atrial flutter has regular atrial activity, sawtooth waves. Sinus tachycardia has normal P waves. Ventricular tachycardia has wide QRS complexes. Question 11. What is the significance of peak T waves on ECG? A. Hyperkalemia. B. Hypokalemia. C. Hypocalcemia. D. Hypernatremia. Answer: A. Hyperkalemia. Rationale: peak T waves are an early sign of hyperkalemia, a potentially life-threatening electrolyte imbalance. Hypokalemia causes flattened T waves. Question 12. What rhythm is indicated by absence of P waves and a regular ventricular rate of 40 BPM with wide QRS complexes? A. Junctional rhythm. B. Ventricular escape rhythm. C. Sinus bradycardia. D. Atrial fibrillation. Answer: B. Ventricular escape rhythm. Rationale: ventricular escape rhythm originates below AV node, causing absent P waves, slow rate, and wide QRS complexes. Junctional rhythm typically has narrow QRS. Sinus bradycardia has P waves. Question 13. A nurse sees pacing spikes before each QRS on ECG, but no corresponding QRS complexes follow. What does this indicate? A. Failure to capture. B. Failure to sense. C. Normal pacemaker function. D. Oversensing. Answer: A. Failure to capture. Rationale: failure to capture occurs when pacemaker delivers impulse, but myocardium doesn't depolarize, so no QRS follows pacing spike. Failure to sense means pacemaker fires inappropriately. Question 14. Which rhythm requires immediate synchronized cardioversion in an unstable patient? A. Sinus tachycardia. B. Stable ventricular tachycardia. C. Unstable ventricular tachycardia. D. Atrial fibrillation. Answer: C. Unstable ventricular tachycardia. Rationale: unstable VT causes hypotension, altered mental status, or chest pain, requiring immediate cardioversion. Stable VT may be treated pharmacologically. Question 15. Which lead placement is crucial for accurate ECG interpretation? A. Limb leads only. B. Chest leads only. C. Both limb and chest leads properly placed. D. Any placement is acceptable. Answer: C. Both limb and chest leads properly placed. Rationale: proper placement of all limb and chest leads is essential for accurate ECG interpretation. Misplacement can cause misdiagnosis. Question 16. Which rhythm is characterized by constant PR interval with some dropped QRS complexes? A. First degree AV block. B. Mobitz type 1. C. Mobitz type 2. D. Third degree AV block. Answer: C. Mobitz type 2. Rationale: Mobitz 2 has fixed PR intervals with sudden dropped QRS, which is more dangerous and can progress to complete heart block. Mobitz I has progressive PR lengthening. Question 17. What is the most important nursing action after successful defibrillation of ventricular fibrillation? A. Continue CPR immediately. B. Check for return of spontaneous circulation. C. Administer atropine. D. Disconnect patient for monitor. Answer: B. Check for return of spontaneous circulation. Rationale: after defibrillation, checking for ROSC is critical to assess patient status before continuing care. CPR continues if no pulse. Question 18. What ECG finding suggests digitalis toxicity? A. ST segment depression with sagging. B. Peak T waves. C. Prolonged QT interval. D. Sinus bradycardia. Answer: A. ST segment depression with sagging. Rationale: digitalis toxicity can cause characteristic scooped or sagging ST depression, along with various arrhythmias. Question 19. Which nursing intervention is critical when monitoring a patient with second-degree AV block type 2? A. Prepare for possible pacemaker insertion. B. Administer calcium channel blockers. C. Encourage fluid restriction. D. Monitor only if symptomatic. Answer: A. Prepare for possible pacemaker insertion. Rationale: Type 2 AV block may progress suddenly to complete heart block. Immediate readiness for pacing is essential. Calcium channel blockers are contraindicated. Question 20. A nurse recognizes sinus arrhythmia on an ECG. What is the usual clinical significance? A. Life-threatening arrhythmia requiring treatment. B. Normal variation, especially in young healthy adults. C. Requires emergency defibrillation. D. Indicates acute myocardial infarction. Answer: B. Normal variation, especially in young healthy adults. Rationale: Sinus arrhythmia is a normal physiological variation related to breathing and usually requires no intervention. Question 21. What does a wide QRS complex greater than 0.12 seconds on ECG typically indicate? A. Normal conduction through the AV node. B. Delayed ventricular depolarization. C. Rapid atrial rhythm. D. Sinus bradycardia. Answer: B. Delayed ventricular depolarization. Rationale: a wide QRS complex indicates abnormal ventricular conduction, often due to bundle branch block or ventricular rhythms. Normal conduction produces narrow QRS. Question 22. A patient has absent P waves, an irregular rhythm, and a ventricular rate of 120 BPM. What is the most likely rhythm? A. Atrial fibrillation with rapid ventricular response. B. Atrial flutter. C. Sinus tachycardia. D. Ventricular tachycardia. Answer: A. Atrial fibrillation with rapid ventricular response. Rationale: atrial fibrillation causes irregular rhythm and absent P waves. Atrial flutter has regular atrial activity, flutter waves. Question 23. Which rhythm is indicated by a sudden onset of rapid, regular, narrow QRS complexes with no visible P waves? A. SVT, supraventricular tachycardia. B. Ventricular tachycardia. C. Atrial fibrillation. D. Junctional rhythm. Answer: A. SVT, supraventricular tachycardia. Rationale: SVT is characterized by sudden rapid narrow complex tachycardia, usually regular with absent or hidden P waves. VT usually has wide QRS complexes. Question 24. What is the first-line treatment for stable SVT? A. Immediate defibrillation. B. Vagal maneuvers. C. Formoterone. D. Atropine. Answer: B. Vagal maneuvers. Rationale: vagal maneuvers are first line for stable SVT to slow AV node conduction. Defibrillation is for unstable patients. Amiodarone and atropine are not initial treatments. Question 25. What rhythm is suggested by a heart rate of 20 to 40 BPM with wide QRS complexes and no preceding P waves? A. Junctional escape rhythm. B. Ventricular escape rhythm. C. Sinus bradycardia. D. Atrial fibrillation. Answer: B. Ventricular escape rhythm. Rationale: ventricular escape rhythms originate from ventricles, causing slow rate and wide QRS without P waves. Junctional rhythms have narrow QRS. Question 26. In which rhythm are flutter waves best seen? A. Atrial fibrillation. B. Atrial flutter. C. Junctional rhythm. D. Ventricular tachycardia. Answer: B. Atrial flutter. Rationale: atrial flutter is characterized by sawtooth flutter waves, especially visible in inferior leads. Atrial fibrillation has chaotic baseline without flutter waves. Question 27. What does a prolonged QT interval increase the risk for? A. Atrial fibrillation. B. Torsades de pointes. C. Sinus bradycardia. D. First-degree AV block. Answer: B. Torsades de pointes. Rationale: a prolonged QT interval predisposes to polymorphic ventricular tachycardia called torsades de pointes, which can cause sudden cardiac death. Question 28. Which electrolyte imbalance can cause peak T waves on ECG? A. Hypokalemia. B. Hyperkalemia. C. Hypocalcemia. D. Hypernatremia. Answer: B. Hyperkalemia. Rationale: hyperkalemia causes tall, peak T waves as an early ECG change, which may progress to serious arrhythmias. Question 29. A nurse notes a pacing spike followed by no QRS complex. What is the clinical term for this finding? A. Failure to sense. B. Failure to capture. C. Oversensing. D. Normal pacing. Answer: B. Failure to capture. Rationale: failure to capture occurs when the pacemaker fires but the heart does not depolarize, resulting in no QRS after the pacing spike. Question 30. What rhythm is represented by a consistently prolonged PR interval greater than 0.20 seconds, but with every P wave followed by a QRS complex? A. First-degree AV block. B. Mobitz type 1 block. C. Mobitz type 2 block. D. Third-degree AV block. Answer: A. First-degree AV block. Rationale: first-degree AV block has a prolonged PR interval, but all impulses are conducted. Mobitz 1 and 2 have drop beats. Question 31. Which is the most life-threatening rhythm requiring immediate intervention? A. Sinus tachycardia. B. Atrial fibrillation. C. Ventricular fibrillation. D. First-degree AV block. Answer: C. Ventricular fibrillation. Rationale: ventricular fibrillation is chaotic electrical activity causing no cardiac output and requires immediate defibrillation. Others are less immediately dangerous. Question 32. What does a sawtooth pattern on ECG indicate? A. Sinus rhythm. B. Atrial flutter. C. Ventricular tachycardia. D. Junctional rhythm. Answer: B. Atrial flutter. Rationale: sawtooth flutter waves are the hallmark of atrial flutter. Question 33. What is the initial nursing action for a patient in pulseless ventricular tachycardia? A. Start CPR and prepare for defibrillation. B. Administer atropine. C. Perform vagal maneuvers. D. Monitor vital signs. Answer: A. Start CPR and prepare for defibrillation. Rationale: pulseless VT is a cardiac arrest rhythm requiring immediate CPR and defibrillation. Atropine and vagal maneuvers are ineffective. Question 34. A patient with a pacemaker reports dizziness and palpitations. What ECG finding would indicate pacemaker malfunction? A. Pacing spikes with no corresponding QRS complexes. B. Normal sinus rhythm. C. Narrow QRS complexes with P waves. D. Sinus tachycardia. Answer: A. Pacing spikes with no corresponding QRS complexes. Rationale: lack of capture indicated by pacing spikes not followed by QRS complexes suggests pacemaker malfunction. Question 35. Which rhythm is usually seen after defibrillation? A. Asystole. B. Normal sinus rhythm. C. Ventricular fibrillation. D. Sinus bradycardia. Answer: D. Sinus bradycardia. Rationale: post-defibrillation rhythm often shows sinus bradycardia before return to normal rhythm or deterioration. Question 36. What clinical sign accompanies sinus bradycardia requiring intervention? A. Hypotension and altered mental status. B. Alertness and normal BP. C. Mild fatigue. D. No symptoms. Answer: A. Hypotension and altered mental status. Rationale: bradycardia causing poor perfusion signs requires treatment. Asymptomatic cases do not. Question 37. What is the hallmark ECG feature of Wolff-Parkinson-White syndrome? A. Short PR interval and delta wave. B. Prolonged QT interval. C. Absent P waves. D. Wide QRS with no delta wave. Answer: A. Short PR interval and delta wave. Rationale: WPW shows a short PR and a slurred initial QRS called delta wave due to accessory pathway. Question 38. What ECG finding suggests hypocalcemia? A. Prolonged QT interval. B. Peak T waves. C. Shortened PR interval. D. ST elevation. Answer: A. Prolonged QT interval. Rationale: hypocalcemia prolongs the QT interval by lengthening the ST segment. Question 39. Which rhythm is identified by grouped beating followed by a pause, caused by progressive PR interval lengthening? A. Mobitz type 1 Wenckebach. B. Mobitz type 2. C. Third degree AV block. D. First degree AV block. Answer: A. Mobitz type 1 Wenckebach. Rationale: Wenckebach pattern shows progressive PR prolongation, then dropped beat causing grouped QRS complexes, followed by a pause. Question 40. What is the significance of an irregularly irregular rhythm with absent P waves and variable ventricular response? A. Sinus tachycardia. B. Atrial fibrillation. C. Atrial flutter. D. Junctional rhythm. Answer: B. Atrial fibrillation. Rationale: irregularly irregular rhythm without P waves is classic for atrial fibrillation, which causes variable ventricular rate. If you found this video helpful, don't forget to like, subscribe, and share with your fellow nursing students. Hit the bell icon so you never miss an update. See you in the next one. Happy studying!